I was written up and almost fired by hospital administration because I did not submit to their demands and apologize. They wanted me to apologize to a rude and belligerent patient that called me out my name and cussed me out using the F word. So around 8:30, 9 o'clock, when I was doing my morning med pass, the patient asked me, "Hey, could you do my dressing change right now?" When I asked him why, he said, because this is around the same time that his home health nurse would come and do his dressing change. So I said to him, now would not be an ideal time because the attending on our floor likes to look at the wounds. And you have a complicated dressing change order and you require being pre-medicated before. So I would hate for you to have to go through that twice in one shift. So if you don't mind, could we wait until after the attending rounds on you, looks at your wound, and then I will come in right after and do your dressing change? The patient was in agreement. So we left it alone. So that day, because there was a code on the floor, the attending rounded a bit later than he usually do. So he rounded on my patient maybe around like 3 p.m. So right after the attending left, I asked him, could I come in and do his dressing change now? Would he like for me to pre-medicate him? Seeing that his dressing is off. And he said, well, actually, there was an NP with the attending, and she put back on the dressing, and he's about to go into a conference call, so I should come back later and do it. I said, no problem. 4 o'clock comes around. I go back. Said, hey, would you like for me to do your dressing change right now? Again, he says, no, not right now. Come back later. I go back at 4:45. Tells me no again, give him a bit more time. He has something that he has to do. I said, okay, I just want you to know I'm trying to get this dressing change done on my shift, but I also have a new admission coming. So I intend to be in my new admissions room for a while. So I would like to get this done as soon as possible. He still refused, which was his right, and he told me he would let me know when he was ready. So 5:15 rolls around. I get report from ER about my patient, but the ER nurse told me that there's about 3 patients ahead of mine, so my patient would be up in about 30 minutes. I was like, okay, bet. I go to the patient and I said to him, hey, would you like for me to do your dressing change right now? He said, come back in 15 minutes. Well, my patient came up earlier than I thought. So now I'm attending to my new admission. So I'm walking to the supply room and I walk past my patient's room that has the wound. And the patient yelled out, hey, nurse. And I was like, I'm coming. I go into the supply room. I come back to his room. He's on isolation, so I'm standing at the door. So he says, I'm ready for you to do my dressing change. And I said, I can't do it right now. I'm with my new admission and this is going to take me some time. I will come back as soon as I get a chance. He said, well, I've been waiting all day. I said, come back as soon as I get a chance. He loses it. You effing nurses, y'all don't have no respect for nobody. I've been waiting all day with this old soiled dressing, and you said you were going to do my dressing, and I know you're just trying to pass it on to the night shift. And I'm looking at him just bewildered. And he was like, y'all don't respect nobody. Y'all don't respect y'all patients. And he was just going off, dropping all sorts of F bombs, and he called me stupid. So while he was still speaking, I closed the door. I did not slam it, but I did close the door and I walked off. So right before I entered my new admissions room, my phone rang. I see that it's the patient, right? Because we have like the mobile phones on us. He's like, when are you effing coming back to do my effing dressing? And I said, I'll get to it as soon as I can, but I'm with another patient. I have to go. I hung the phone up. All right. About 20 minutes later, I'm walking out of my patient's room, the new admissions room, and I see the charge nurse in the hallway waiting on me. So She says to me, "Hey, what's going on with patient so and so with the dressing change? Because he called and he is very upset. He says that he feels disrespected. He says he feels like no one cares about him getting better. He says that he feels like we are delaying his care, and he's saying that he got better care at home than he was getting at the hospital." So I explained to her everything I just told you. And she's like, "Oh, well, I understand, but just go in there and apologize to him and let night shift do the dressing change." And I said, "Oh, night shift can do the dressing change, but I'm not apologizing." So the charge nurse says, "Just go on in there, apologize to him, and don't let this be a fallout." I was like, "No, I'm not apologizing to anyone that has disrespected me and having them think that that's okay. Like, he's not going to disrespect me. I'm someone's child. You're not going to disrespect me." So she's like, "You know how our manager is. We don't want this to become a customer service issue. We don't want this to become a fallout. You know we care about our HCAP scores, and let's just end this right here and apologize." I said, "No, I am not apologizing." So it was about 6:30, and I said to the patient, "Hey, would you like for me to do your dressing change?" He said yes. I pre-medicated him, and then about 10 minutes later, I went in his room and I did the dressing change. He was pretty quiet while I was doing it. I was pretty quiet. I did the dressing change, walked out. It was over. So the next day, I get called into the office right before lunchtime, and the manager was like, um, "Tell me about what happened yesterday with Mr. So and so and his dressing change." I told her, and she said, "Well, did the charge nurse tell you to apologize?" I said, "Yes, she did." And she said, "Well, did you apologize?" And I was like, "No, I didn't apologize." And she was like, "Well, because you did not apologize, you're getting written up." And I was like, "So it's okay for patients to disrespect staff and just everything is okay?" And she was like, "Well, it's about patient satisfaction and patient perspective, and the patient experience, so you should have apologized." And I was like, "Well, write me up then, because I'm not apologizing." And new grad nurse, baby nurse, nurses that are in the early parts of their careers, I want to tell you something, and please listen to me. I was wrong. It's been a few years now, so I've had time to think about it. I was wrong. As the professional in the situation, the standard for me is significantly higher. I'm not the patient, I'm a trained professional. No, I shouldn't be disrespected when I go to work. But you don't know what it's like being a patient. Just think about his situation. He's a paraplegic. He's having health issues. He feels like he's lost his autonomy. He's lost control of his life. He probably is depressed, going through a lot, maybe physically, emotionally, spiritually. And the littlest things may trigger him, and many of our patients, right? And I took the one thing that he had control of, which was the time that his dressing change was done. And we have to try to get into the mindset of our patients. And regardless if he was wrong, because so many things have already been taken from this man, I could have given him empathy. I could have apologized, and that could have just changed his entire experience. I've had multiple situations after where patients have disrespected me, and I've let it breathe, and I've came back and apologized to them. And my relationship with those patients became rock solid and tight. So as nurses, we have to be servant leaders. And sometimes that's apologizing to a patient who's completely disrespectful. It's okay. It's okay. Just who saw it off, and just think about it. You are here to serve people.